Hi, I'm Larry Huppin. I'm the Medical Director of ProLab Orthotics, and today we're going to be looking at another one of our pathology-specific orthoses. As we've mentioned earlier, these pathology-specific orthoses are based on the best evidence in the literature in trying to come up with an orthotic prescription for any particular pathology. Today we're going to look at a device for posterior tibial dysfunction. These are severe flat feet, usually also known as the adult-acquired flat foot. We're going to be looking primarily at orthoses for the flexible type of adult-acquired flat foot. Our goal here is to try and offer some sort of support for this foot. These are very difficult feet to control with an orthotic device. A couple things to keep in mind is that as that foot pronates excessively, we're going to have to find methods to apply force medial to the subtalar joint axis in order to try and resupinate that foot, or at least trying to prevent it from pronating excessively. So on our orthotic prescription, we're going to do several things. First, we're going to use quite a deep heel cup. We would recommend at least an 18 millimeter heel cup, and it's not uncommon to use up to a 20 or 22 millimeter heel cup. On our pathology-specific device for this pathology, we are using a 20 millimeter heel cup. In addition, we are using a very wide orthosis. You can see that we've actually incorporated a medial flange that comes up around the medial arch of the foot. You want to make sure you have surface area of the orthosis under the entire foot. We're incorporating a minimum cast fill so that the orthosis conforms very tightly to the arch of the foot to prevent collapse of the arch. We're also going to incorporate a medial heel skive within the heel cup. This is a varus wedge that is added into the interior of the heel cup. That varus wedge acts to shift the center of force of that orthosis farther medial to the subtalar joint axis and applies a supinatory torque around that axis. Many patients with posterior tibial dysfunction and adult-acquired flat foot will have a very prominent medial navicular, which can be irritated by the medial flange. So we will incorporate a sweet spot, essentially a pocket within the plastic of the orthosis to accommodate that prominent navicular. And then finally, we put a cover on there for cushion and a rear foot post to prevent the device from rocking in the frontal plane. So that is the pathology-specific orthosis for treatment of posterior tibial dysfunction and other severe flat foot deformities.